Everyone, welcome back to Biophilia, your all-time study mate. Today we are going to discuss about the disorders and fractures related to the skeletal system. If you like this video and get some help, then don't forget to like, share and subscribe to our amazing channel Biophilia. So here we are to understand about the disorders about the muscles. So related to muscles, we have our first disorder, that is myasthenia gravis. Myasthenia gravis, we are going to see some words that you can break out. The my is going to be related to the muscles, whereas asthenia is going to relate to the weakness. So जब muscles में weakness होगा and because of that weakness, just as it happens to the graveyard, so graveyard में जिसको the bury किया जाता है, the same weakness of the muscles, like say there is weakness of eye muscles, there is drooping of one or two eyelids, there might be blurred vision, anything can happen that is related to weakening of the muscles. So this myasthenia gravis is nothing but a autoimmune disorder. Autoimmune है, that means your own immune system is going to destroy the cells, यानी self attack होगा onto the cells. जो आपके cells है उसको differentiate नहीं किया जाएगा and your own immune cells are going to attack your self cells. So antibodies are going to attack onto the acetylcholine receptors, and because of that, when the neurotransmitter cannot bind to the receptor, there is going to be impaired nerve transmission, and because there is lack of nerve transmission, the nerves are not going to be able to send signal to the muscles, और muscles को जब signals नहीं मिलेंगे, they start to become weak, they don't know, they don't understand what to react, and that leads to paralysis, that is they are going to stop functioning. So that is the case that happens in myasthenia gravis, wherein the normal neuromuscular junction is going to be disrupted, and because of that the facial expressions might change. So you might see a person who has weakness in eye muscles, you can see drooping of one or two eyelids, that is called as ptosis. You can also see persons having symptoms of blurred or double vision. So double vision, you can call it as diplopia. There might be a change in facial expression, difficulty in swallowing because the swallowing muscles, esophagus में contractions will be disrupted. There will be shortness of breath. There may be impaired speech, and impaired speech, that is nothing but dysarthria. So all these things can be seen in the person who is suffering from myasthenia gravis. So the second one we discuss is muscular dystrophy, which is a bit different from the previous one, that is myasthenia gravis, because myasthenia gravis is going to be an autoimmune disorder, whereas muscular dystrophy is a genetic disorder. That means it can be passed from your parents to the children or the offspring that they possess. So that is a genetic disorder, whereas autoimmune disorder is not exactly being transferred from one generation to another. So what exactly is the genetic disorder? So genetic disorder, once the genes are disrupted, the formation, as you might know, कि अगर gene में कोई disturbances है, that means the DNA is not functioning properly. That leads to the RNA not being formed properly, and when RNA is not formed properly, it is going to impact the protein. So that is the central dogma that happens. So if DNA is not functioning properly, finally the impact is going to be seen onto the proteins. So here the protein which is not formed properly or is disrupted, that is the protein dystrophin. So this dystrophin protein, what does it do? It is a large protein that is needed to have connection on the actin filaments. So as you might know about the actin filaments, these need the providing strength to the muscles, and it is essential for contractions of the muscle. So if by chance the dystrophin protein is not available in the normal individual, it is going to disrupt the normal functioning, and that is the contractions of the muscles. So that is the case of muscular dystrophy. So normal biceps, you might see over here in the figure, the way they look is different than the case of the person who is suffering from muscular dystrophy. The muscles will not be full, they will not be, in their normal shape and size. So all that is going to reflect onto their muscular movements. So this is a genetic disorder which is being called as a X-linked recessive inheritance. So you might have known about the Mendelian disorders. So Mendelian disorders may how the Mendel had discovered similar traits are going to be followed over here for the X-linked recessive inheritance. That means there is going to be a carrier, there is going to be a condition of unaffected and the condition of affected individuals. So based on that, you can understand if the offspring is going to be having a chance of muscular dystrophy or not. So this is a genetic disorder, and the previous one that we had seen was an autoimmune disorder. So the difference needs to be understood because that is a possible differentiating question that might be asked. Moving to the next, that is osteoporosis, which is a skeletal disorder. So abhi jab to do dekhe the, they were related to muscles, but osteoporosis, the word osteo is going to relate to the bones. So it is a skeletal disorder wherein the bone is going to lose its minerals and the fibers from the matrix. When the fibers and matrix यानी जो चीज bone बनाता है, that is once been losing out, that means the bone mass is going to decrease, यानी जो उसका वजन होगा bone का, that is going to decrease. The bone mass is decreasing, that is the bone is becoming more prone to fractures. So bone is becoming weak. When once the bone is weak, the fractures are much more easily occurring, and this can be a age related issue. It might be a hormone imbalance, as we had seen about the calcitonin hormone, and we had also seen about the parath hormone. So once the functioning of these hormones are not functioning properly, the osteoporosis can take place. It can also be because of the deficiency of calcium. It can be because of vitamin B deficiency, and even it can be because of some decrease of sex hormones, majorly estrogen. So that is all one of the case that can lead to osteoporosis. So how is the X-ray going to be different for a person who is normal and the person who is affected or who is suffering? So the one who is normal is going to have much more difference in the gradients. यानी white spots ज़्यादा white होंगे, they won't be grayish. But in the affected individuals, you might see if you compare the A and B version, the B one seems to be more grayish. So the grayish one, that means the calcium content in the bone has decreased, and once the calcium content is decreased, that means there is more air spaces, because once there are air spaces, the air spaces is going to lead to black place. So जहाँ पे भी air है वहाँ पे black है, and air is increasing, that means black area is increasing, the bone mass is going to decrease. So that is one of the case that you need to understand over here, and from that we can understand if the person is suffering from osteoporosis or not. So the next we see is about tetany. So tetany is going to be about a rapid spasm. That means there is rapid contraction and relaxation of the muscles, and that is going to occur because there is lesser calcium content in the body fluid. जब calcium कम होगा, the person is most likely to suffer from tetany. So here are some of the influences of how the person would be coming to you in the hospital who is suffering from tetany. So there might be foot drop condition. You might see some changes in the locations of the foot. There might be some changes in the position of the fingers, and from these some conditions you can understand that the person might be suffering from tetany. So that was the fourth condition that can be seen related to this system. The next is going to be about rheumatoid arthritis, which is going to be diagnosed by a presence of rheumatoid factor. So अगर ये factor present है, then you can give the confirmation about the occurrence of rheumatoid arthritis. So what is the major symptom if the person is going to come and tell to you? It is going to be about the inflammation of the synovial membrane. So if you might have heard about the synovial joints, that means the joints which are freely movable. These joints are going to have the synovial membrane, the synovial fluid. So whenever there is inflammation in these membranes, the membranes, if they are left untreated, that means you do not know about what is happening and you just leave the symptoms unnoticed, then the membrane is going to thicken, and once the membrane is thickened, what will happen? The synovial fluid inside the cavity is going to increase. And because the fluid increases, the quantity increases more than it should be, there is going to be excess pressure, and that excess pressure onto the joint while movement is going to cause pain. So the person will be coming to you with inflamed joints or joints जब inflamed होंगे, you can understand the person also complains about pain once the person is moving those joints. So once the membrane starts secreting abnormal granules, that is called as pannus, these pannus will be accumulating onto the surface and it will cause erosion. So even the bones are going to start to disrupt in that location. Bones भी affect होना शुरू हो जाएंगे, and this all condition is going to make the joints unmovable, and it is going to need heat treatment, physiotherapy, pain and inflammatory medications to be going on. And in extreme cases, if the person is still avoiding to go to a clinic and have some remedies to be done, then the inflamed joints are also needed to be replaced. So it is better if you have some joint pains, or if someone is having some inflammation in their joints, it's better to go and check for rheumatoid arthritis, and for that you can avoid the replacement and more infections around those areas. So that was about rheumatoid arthritis. You can see in the figure how the healthy joint is going to differ from the joint that the person has in rheumatoid arthritis. You can also see about how the joints are going to be varied. The joints will not be functional. The person does not move them because it gives it pain. The joints will start to look different, and all this can lead to you concluding about the rheumatoid arthritis. The next is going to be arthritis. Arthritis is a disorder जहाँ पे there is inflammation of the joints occurring. Just like rheumatoid arthritis, there is going to be pain, there is swelling, there is redness, as well as some heat occurring in that area. It is again related to the synovial, spaces around, and there is cartilage loss, there is joint space which is narrowing down, there can be bone spurs, that is bone is getting destructed over there, and because all such cases there is going to be inflammation in the joint, or joints में जब inflammation होगा, they won't be moving in their normal conditions, and that will give the person pain, swelling and redness. The next is going to be osteoarthritis. It is again a destructive joint disease, and this joint disease is regarding the degeneration of the articular cartilage. So these are all the stuff that we had seen in the joints video. So if you want to see more about these joints, then we had already discussed it in part 3 of this chapter. So you can surely go down and check on the link below. So that was about the osteoarthritis, which is generally going to affect the joints of spine, knees and hands. So that can be the possible areas to direct you about for osteoarthritis. So you can surely go and check out the differences between the arthritis, osteoarthritis. So how they look different. You can see the images. So this one was for arthritis. The below one is going to be for the osteoarthritis. And the previous one we had seen was for the rheumatoid arthritis. So all are related to arthritis, but there are some differences that needs to be understood. The next one is gout. Gout is again a type of arthritis, but here there is going to be the inflammation of joints because of accumulation of uric acid crystals. So what is the major key point to remember about? That is the accumulation of uric acid crystals. So that is the key to remember about the gout. So whenever there is excessive formation of uric acid, the body is going to deposit it into the synovial joints. And once there is accumulation of uric acid in this joint, there is going to be person complaining about the pain in joints. There will be swelling in the joints, and that can assure you about the gout that is occurring on that joint. So whenever the person is, having gout, there is going to be, dysfunctioning of the uric acid metabolism. And because of that, the excessive uric acid is going to accumulate into that area. So that is the difference between gout and the rest of the different arthritis. The next we see is dislocation. So dislocation you might have, more commonly heard of during your regular talks between your friends. So dislocation is going to be the displacement of the articular surfaces of the joint. So जो दो bone एक साथ रहने चाहिए थे, in their normal condition, they are going to displace from their normal position, and because of this there is going to be damage to the ligaments that were surrounding onto the joint, and because of dislocations there is going to be, you can see that the fingers, if the dislocation is in the fingers, then the fingers do not appear to be normal. अगर thumb में है तो thumb की normal position से ये कुछ और ही दिखेगा. If there is dislocation of shoulder, the shoulder might seem that it is not on its normal position. So you can, very well pick up that the joint has been dislocated from its normal position. So if you see the X-ray over here, this is the condition of a normal person. Normal mean X-ray should look like this. But once it is dislocated, how it would look like this. And from that you can understand that externally it might have swelling because the cartilage has been, disrupted, the ligaments have been torn off, the bone has been shifted from its normal position. That is going to give a person lot of pain and also loss of motion. That is, the person cannot move that joint because it has been dislocated from that position. So the person cannot move that area as well. The next is going to be about sprains and strains. So this is very common for the athletes, for the people who play a lot. So sprains is nothing but the twisting of the joint without dislocating it. This word is very important, that is without dislocating, because if the joint is getting dislocated, then it is no more a sprain, but it is a dislocation case. So in this area, you are going to have the damage to the ligaments. There is damage to the tendons, there might be damage to the muscles, the blood vessels, nerves, and in severe sprains it can also have some immobilization during the healing process, but that may be, recovered as you give rest to that particular joint. So that is just a twisting, that is not going to lead to severe dislocation. वो बस थोड़ा सा हिल जाएगा अपनी जगह से, but it is not as severe as dislocation of the joint. With, giving rest, it will heal out much sooner. The strain is going to be even more less severe. It is just like a severe stretching of that particular joint. There might be muscles and the tendons that might be stretched out, which is somewhat painful. So जो आप बोलते हो बहुत ज़्यादा खिंच गया है पैर या नसें खिंच गई हो, so that might be a little damage to the adjacents of the joint, and that is the strain. So strain, then the sprain, then the dislocation. All these are some of the terms which are related to the disorders of the joint. So you can see the differences over here between the sprain and in the strain. So strain is much more common in the terms for the muscles and the tendon pulls, whereas the sprain is much common for the ligaments, the tendons, and the twisting of the joint. The next we see is about fractures. So fractures is nothing but we call the breakage of the bone. So breakage है यानी bone टूट रहा है, so it can be either a complete break or it might be a incomplete break. So based on the different types of fractures, we here are going to discuss about the major four, that is the simple fracture, the green stick fracture, Then there is comminuted fracture and the compound fracture. So the first, that is simple fracture, has the name simple. It is just breaking of the bones. यानी एक bone दो टुकड़ों में टूट गया, that is a simple fracture. So that is full, that is a complete bone that is getting detached from each other without breaking the skin. So skin is not hampered. बाहर से आपको skin में कोई notice नहीं होगा. But once you take a X-ray, the X-ray is going to show you that there is going to be a crack onto the bone. So that is just a simple fracture. The green stick fracture is again a break in the bone because we are speaking about fractures. So it is in the form of a crack, right? So पहला वाला क्या था? It is complete break. 2 parts हो चुके हैं, यानी आपने एक बिस्किट का टुकड़े को 2 टुकड़ों में कर दिया, that is a simple fracture. Green stick fracture है, यानी you have bent it, there is a slight crack onto the piece, but the 2 parts of the bone are still holding to each other. यानी एक पार्ट में ही ब्रेक हुआ है, the rest of it is still intact. 2 टुकड़े complete नहीं हुए हैं. So that is the case of the green stick fracture. The second, that is the third one now, is the comminuted fracture, wherein there is going to be more than 2 fragments of the bone, and over here there is going to be bones which is losing their connection for the blood circulation. यानी एक बोन के ही बहुत सारे टुकड़े टुकड़े हो चुके हैं. That is the comminuted fracture. The last one is going to be the compound fracture, wherein the ends of the bone that is fractured is protruding through the skin. So here the skin is also undertaken, or skin ke bahar you can see the bone. So up till now the 3 fractures that we had seen were inside the skin. Skin ke bahar se you cannot see anything, but in compound fracture the bone is going to stick out of the skin and you can see the broken ends of the fractured bone as well. So you can see the different images over here for the X-ray or the real life photograph as well. That is going to help you to understand the different types of fracture that we can see normally. So that might be very simple for you to understand the different kinds of fracture. So based on the how they look, you are going to classify them into these 4 categories roughly. So I hope that was helpful for you to understand about the disorders and about fractures in detail for this chapter. That was all for it. We will come back soon with one more such amazing chapter video. Till then, bye bye everyone. Do not forget to like, share and subscribe to our amazing channel if that helped you in any ways. Till we come back, bye bye everyone. Thank you.